And you could see these guys' tendons in their face, right? It was like, ooh, yeah, it just like skin and bone. It looked like literally like a corpse.
Yeah.
And so watching, I would just...
Beauty cults are developed virtually from social media. And social media is not
100%.
casual. It's literally like your left arm.
You can't open your airway in your lungs. Like,
Right.
It stops you from being able to do that.
So maybe it's just like a misunderstanding and then misinformation.
Hey everybody, it's Erin Alonso from Dermafex, and I'm here with my friend Gemma Touchstone.
Hi.
Today we are going to talk about beauty cults. Woo. There is such a thing as a beauty cult. Wait, okay, but first of all, I got to get with my question.
Okay.
We had a question, so I love that you guys are asking questions now. It's super cool, but somebody wanted to know, what is a reasonably priced way to end the timeline for Sculptra?
Ooh, I want to know that.
Okay, so Sculptra is a collagen stimulator, so it's kind of hard to answer that without seeing you and how old you are, and how thin you are. But if you're like a bony person, you need kind of more. Older, of course, needs more because it stimulates your collagen. So if you have a lot less collagen than, say, somebody super young, you're going to need more. But the nice thing about Sculptra is because it's a collagen stimulator and it's over time, you could do it on a budget because you could just do one and wait and one and wait. So there's not really like a super strict timeline. So if money's tight, it's not like one of those things like in a series where, like laser, for instance, if we're going to stimulate that collagen, we got to do it together, like kind of a thing. So
There's no cell cycle.
no,
Yeah.
there's not. So the nice thing about that is you could do it every even other month. And let's just say you're 40 years old and of an average weight without a super bony, skinny face. I would say if you did one every 3 months, in that year's time, you would have done 4. Yeah. I think you're going to be pretty stimulated.
Really?
Yeah.
And is that the same as, like, say like you're taking collagen supplements? Mm-hmm. You're talking about beauty cults. There's like collagen cults, right?
For sure.
All the different kinds of
yeah.
collagen.
Mm-hmm.
But like, how do you know? Like, would you just keep doing that, or is this like a totally different type of collagen, like in your system? Is it the
Well, it's
same
stimulating
kind of collagen?
your collagen.
Just anything
it's
that you're
not
doing.
like bovine or chicken or
okay.
plant or it's a stimulator for you.
Yeah,
So,
that's interesting.
well, I'll give you for instance. So way back when, I was really lucky and I got to do the HIV, help them with the HIV studies. It was cool because I got to put all the product I want in guys that were super duper sick. I mean, back in the day with AIDS and HIV, I mean, you might as well have just tattooed it or burnt it on your forehead because you looked like The Walking Dead. It was super scary looking. Like when they would come in, we knew.
That's crazy that you mentioned that, because that is true. Like, you don't see that anymore.
No.
But like,
well,
when
the
I was
drugs
in high
have
school,
changed.
you could tell if somebody was very ill or not.
Yeah.
Like, from
So the
HIV.
drugs have changed, but before that, it was like fat eating drugs. So that your face, I mean, you could see these guys' tendons in their face, right? It was like, ooh, yeah, it just like skin and bone. It looked like literally like a corpse.
Yeah.
And so watching, I would just blood. Like, man, I was like, oh yeah, I was like loading these guys with all the product, and to watch that
see what
stimulate.
happens.
Oh, it was awesome.
Oh my
This
gosh.
is like way before we video. There was no such thing as video. I mean, you'd have to have like some company with a huge camera come in. Like, this was way back.
Yeah.
And so, but to watch those guys and give them their life back, it was so, it was I love doing it. Honestly, some people are like, aren't you afraid?
Because
I
it's
don't
like
know.
dramatic results.
Dramatic. I mean, they went from being housebound, they would go nowhere ever, to like a full life back.
Right.
But
Because of confidence.
That's right.
Yeah.
Because no one wants to walk around going, you have AIDS?
Yeah. Like, no,
Like-
nobody wants to do that.
Right? Like, no, it was
Yeah.
literally like everybody looked at you and was like, AIDS,
Oh, you knew it.
AIDS,
Yeah.
AIDS.
Yeah.
So it took that weird, like, kind of feeling away.
Stigma.
And man, did they all just, I mean,
That's so cool.
yeah, because they were skin and bone. So I got to watch like what it did, and really it works. It totally
That's
works.
amazing. So
And
how do you inject Sculptra?
you kind of just put it like in points where
Yeah.
you'd want to like lift naturally, where we have like just different areas that either indent or like, you know, like this part of my cheek, I want it to be a little bit higher. I don't want my chin.
So it'll just like lift a little bit, like a little.
it.
Like if you just have like these little wrinkles or whatever,
Well,
can it do it down
so this
your
is the
lower
deal.
face?
It doesn't work like immediately where you inject it and
have
go,
to
there
wait,
it is.
yeah.
You have to wait over time, right? So
Right.
that's the thing with with it. It's hard to tell somebody you need exactly this many because I don't know what the collagen is like in your body.
So how do you compare like collagen stimulating laser treatments like Thermage or something to Sculptra?
Sculptra's just injected, and any of the lasers or any kind of thing with radio frequency, it is creating a little tiny injury, and your body responds to that injury by making collagen.
Yeah.
So that's kind of the same way. It's just doing it externally versus injecting it.
So crazy.
Yeah, but we've injected Sculptra at Dermafix for a super long time and have a ton of experience doing it. Like, I mean, a lot of experience. And
it's taken a long time for it to like trend up. Like now I feel like everyone's about
it's coming
Sculptra.
back now because
Or
everybody's
did
like,
it, and then it went away, and then
you
it
want
came back.
collagen stimulators, you don't want fillers, and but really fillers do work as collagen stimulators too.
Yeah.
So I think people
Interesting.
are just confused about that. They think because they've seen so many overfilled people. And my big thing to tell everybody is a little bit does a little bit and a lot does a lot. You don't
Do you want a little or a lot?
Yeah, you don't have to walk around looking like an alien. Like, I don't want that for you. I mean, I guess if you want that for you, that's different.
Right. Totally.
Right?
Yeah.
So I feel like we're kind of like commissioned artists. Like, and some people do want to look
And I
funk
feel when
alone.
it's overdone, I feel like it's just you're going for something that maybe you're not using the right product to get the result. And so then you just have that overdone look.
Okay, so that comes into our cult talk.
Yeah.
Here we go, right?
Yeah.
There's people addicted to the needle.
Right?
Straight up. Like, I hear it at least once a week. I love the pain.
Same with tattoos.
There you
know,
go.
the
It's like
tattoos are
that. Like,
addictive.
and it's like, at least I'll say 85% of people are pretty normal about it, where I'm like, no, not there. It doesn't look natural.
Right.
But
And
then
they're
you
like,
get,
okay.
and then they're like, okay, do what you think. Because I don't really like, I don't want you to be out of proportion for you.
Right.
Like, don't, because your friend had it, you need it. Like, don't come in saying that.
Totally different.
You don't look like your friend.
Right.
You don't have the same whatever, right?
Everything.
So, there's people that follow people. And then, like, the other cult that comes is, like, we start to normalize it, like, on social media, right? Like, let's say, for instance, lip flips. Man, we've done lip flips for 20 years. Now, all of a sudden, everyone's like, oh, I need a lip flip. Lip flips. Like, I mean, okay, but, like...
You're like, this has been happening, but we named it lip flip, and now it's
everyone's
cute,
all,
and everybody's getting it.
That's exactly right.
Yeah.
So
And we say social media like it's casual, but when you talk about beauty cults, like beauty cults are developed virtually from social media, and social media is not
100%.
casual. It's literally like your left arm. I mean, if you're looking like maybe for us because we're older, but like if you're looking at somebody in their 20s or early 30s, like their whole life is based on what they're watching.
That's right.
So it's like so much more
It's
than
like their
just
Bible of what they should do with their life.
Yeah, it's like this is your friend, your mom, your aunt, your
all your
everybody.
advice comes from that. Yes.
So you're watching so if you're on there watching like The Ordinary, which is like a big beauty call, right? Like beauty products.
Yeah.
Or how a Drunk Elephant like totally became popular
Took
with children for some reason.
Yeah, exactly.
It's like, what is that? And like you're convincing your mom to buy you like some retinol cream and you're like 14.
I know, it's crazy.
It's actually like real.
It is real. Well, let's take a look at this one video and see what this girl's
see. I'll
chatting
try to
about
watch
here.
it.
Okay.
Do you have an injection for eyes? I can't.
I know, right? I wish.
I'm on the no Botox train, unfortunately, for now. It's been 20 months. Who's counting?
I'm now on the no
I don't know who's
Botox
counting.
train.
Really?
Yeah.
How long has it been for you?
Not that long, but I listened to your episodes and conversations around this, and like I'm spooked.
True Botox poisoning. People have descending paralysis. They can't swallow. They can't breathe. They have to be intubated. Like, it's scary. And I always wonder, like, because I'm not anti-Botox and
Girl.
I'm vain and I'm like public facing and I'm aging. I'm almost 40. Like, it's hard. It's hard to be a woman. I do think sometimes I wonder if I could ever get it again, you know? But then I'm like,
why weren't you intubated?
I don't know. I know too
Intubated?
much now.
Like,
It's like
wait, what?
terrifying. How could I ever get it and not
Yes.
have that in the back of my mind? Because it does feel a little bit like Russian roulette.
Okay.
Girl, okay. First of all,
don't even know.
shut the hell up. Are you a medical doctor?
I just would like to see a case of somebody intubated from
One case. Find me one case somewhere.
from having a
one.
Botox injection.
Stop.
I mean, even an allergic reaction. Like, I mean, how could that even
No,
be possible?
these people. Okay, so I think they
This
get
is
on
the
this
problem
whole
with social
buzz
media.
train, right? Like, hey, everybody, there's Botox poisoning and blah, blah, blah.
Yeah.
Okay, yeah, there's botulinum toxin poisoning. Has nothing to do with Botox though. It's like when they make a vaccine, they pull the protein off, it's purified, and then they make it like that.
Could you imagine if everybody was like, you're injecting me with smallpox, you're injecting me with whooping cough?
Yeah, you'd lose your mind.
I mean, like, could you imagine? That's virtually the same thing, isn't it?
Yeah, that's
like,
what they're saying.
Like,
no, it's a bioweapon.
You're injecting me with botulism. Well, that's like the same as all the vaccines that everybody.
It would be considered like a bioweapon if you could kill people with that.
Yeah,
like seriously,
it's actually crazy. There's just so much misinformation that it's actually a draining.
Stop. Like, I mean, it doesn't go anywhere. There's no drug that's been studied like Botox. Okay, Botox has been around since the 70s. Believe it or not. Bring it on. I want to see any of these. All these girls are talking because they all want to be on social media with some weird buzz. Like, I think we need to come up with something like, oh my God, if you do 80 units or more of Botox, your hair will grow back. Maybe we need to start that and see how we can trend it. Like, because everyone's losing their hair. Be like, you guys, my hair just started growing because I did 80 units of Botox. Like, get on it.
People would be lined up right now. I would be one of them.
Let's do it.
If you could tell me that my hair would go back to looking like your hair naturally, I would be lined up and I would pay any price.
But they just talk out of their ass. I'm sorry.
Well,
but
intubation, that's a very serious, like that. I mean, you're like on your deathbed when you choose that.
Yeah, that means you cannot breathe.
Yeah.
I think that they're mistaken for somebody looked up botulinum poisoning probably
or something. I don't know how she got into that.
Oh my gosh, because that is what you get from botulinum poisoning. You actually will suffocate to death.
Yeah.
So that's that.
So that's not from Botox. Though.
No, that's a totally like, let's get it right.
That's crazy.
That's like, don't take penicillin because it's made out of bacteria.
It is nuts though that you can just kind of like
say whatever
your opinion on whatever you read. You can go make a video and then like whatever hundreds of people that are watching that. Like my daughter showed me a video the other day and it was total satire and she did not tell me that it was. And then on Mother's Day, we're with the family and I'm telling the whole story and everyone's looking at me like I'm crazy. She's like, I didn't tell my mom that was fake. And I was like, I just repeated a ridiculously fake story and made myself look like an idiot.
Oh my gosh. Oh my gosh. Okay, let's listen
I think that's what's happening here. Okay, let's watch this.
Anything related to Botox injury, I just keep thinking back to like breast implant illness. And, you know, you have all these women who have gone back to their providers and they're like, no, this is from something else. This is not from your breast implants. It's because of, you know, whatever. Do you think that there's a lot of kind of similar stuff going on when it comes to the Botox injuries?
I do. I think that that's happening a lot. And I think that the reports that are in the database that are put in by providers or nurses within the practice say, I think that those are rare. I don't think that happens very often because I think you're right. I think the overarching narrative is that whatever the person is struggling with can't be from or isn't from the botulinum toxin.
Is she a qualified medical professional?
Okay, so I'm sorry. I know lots of people that have had their explants done too, and a lot of them are like, most of them are like, well, I don't know.
Right.
As we get older too, and our hormones switch, I mean, we feel the worst we're ever going to feel. So yeah, I think psychologically too, you can work yourself up into anything.
That's
like,
true.
oh, take out your implants, you'll feel so much better. And if you hype yourself up over that, same with Botox.
You're going to feel better.
100%.
Right.
You like your mind is what controls your body.
Right.
I believe that, but I don't know. This whole mission that these girls are on, I just feel like you either can't afford it, you're a hater. I feel like there's other reasons.
Like what's happening?
Like you, I don't know. You need attention because you need attention. I don't know.
Also,
I just
think
feel
it's like a very personalized thing. Okay, and first off, like breast implants, that's like it's more affect your body than a Botox shot too. I mean, you are like having surgery. You can develop things like blood clots or different things because of surgery,
for
right?
sure. Yeah.
So there's things that can happen. I think like comparing implant disorder, like
okay, so
to
I have
Botox is
injected
totally different.
Botox for full time for 25 years.
Yeah.
I can honestly say, God's honest truth, I have never called 911 for one person.
Right.
Ever.
Yeah.
Ever. I've never heard from one person that they've been intubated. I've never heard from one person that they went to the ER.
And you have literally probably seen over 100,000 people.
Oh,
and like
girl,
so many people.
But anyway, I mean,
yeah, and
so much Botox by the gallon, right? If I thought there was anything that could hurt anyone, I would never
do it.
ever pick up another syringe. I would be like, what? But bring on the studies. Like, you don't just say whatever.
Yeah, it's so random.
And you know what? Maybe there is somebody that has a bad reaction to Botox, or maybe, do people get like headaches or like weird, but that could be from getting poked too, or maybe they do have.
It doesn't matter. It's just so individualized.
That's right. You can't speak for like the whole of everybody. And I think that goes for your breast implants too. Like, your body is, if there's a foreign something in your body, could you personally have a reaction to it? Sure. With anything, I would never say, no, you can't, but it's not the masses, or I feel like we'd all be dead. I'd be gorked out of my mind.
Right.
I mean,
oh my gosh, that's the scary part too. It's
I wouldn't be able to sit here right now if any of this was true. I would have been intubated 98,000 times. What? Like, come on.
Oh no.
I don't know. I think Botox makes me feel better because I don't know, if I feel frump-a-dump, I'm like,
yeah, then you don't want to leave the house. What's more dangerous? Never leaving?
it's horrible to feel ugly though. I don't know. It takes my mojo, and I think most women are like that.
It does, yeah.
I mean, that's why I love. I think it helps women on so many levels. And I say it all the time when somebody walks in like they're depressed. I'm like, girl, just get poked in the forehead. You're going to feel so much better. It's the cure for depression. It really is. Like, I'm sorry, but the benefits outweigh the risks for sure. Like, you know, this illness. I don't know.
Actually
What's
seen
illness?
anybody. I mean, this is all speculation. Like, I actually haven't even seen anything online of people claiming to have Botox illness. Have you seen that?
No, but I mean, she's got quite a few followers. Like, she's just trumping this up big time.
With no medical backing.
You know, I didn't look into it that much.
And is she a medical professional or is she a blogger?
You know?
Yeah, so this is just opinions. It's like when we're sitting around the table and we're just like, well, what if?
Right.
You know, I mean, we don't actually know anything about that.
I mean, are you going to compare it to the poison air we breathe, the garbage food we eat, like all the rest? I don't know. Like, where do you draw the line and what's what?
I know, that's exactly right.
Our poisoned water, it just goes on and on of what is garbage
I wonder what that is then, because it's actually what you said kind of true. Like, I wonder why, like, some people are just such haters on it. Like, you know, like you can be haters on some things like McDonald's. Okay, because we know McDonald's, we've seen the machines and the pink slime and all the weird stuff, right? But like, I haven't seen like a bunch of stuff on Botox
like
or
intubated ladies. All
yeah, like I mean, come on, like what? 1 out of like billion people. I mean, literally.
I've never even heard of it,
and I've never heard of it until this girl said it.
Never.
Yeah, and it kind of hits home because my brother-in-law actually passed away and he was intubated. This was literally last month.
You've never seen anybody
and
intubated,
so I
it's
understand
crazy.
the whole intubated process. I was right there watching it, and I'm like, this is not even in
I
the
used to be a
same
trauma nurse. I've seen so many people intubated.
world.
You are dying. Like,
Yeah,
you're going
like,
down
this is
for the
not-
count. This is like a last ditch effort to try to save your life.
I don't even know how that could affect you in that way. Like, I don't even know how a Botox injection could affect your whole body in that way.
Well, botulinum toxin poisoning.
If it was actually botulism.
Right. If you have botulism poisoning, which I've actually seen before, it paralyzes all of your smooth muscles.
Wow.
So you're not able to breathe.
Yeah.
Basically.
Well, then that would
well,
make
actually,
sense.
that's not your smooth muscles, but not your smooth muscles. That would be like your heart. But like you can't open your airway in your lungs. Like it stops you from being able to do that.
So maybe it's just like a misunderstanding and then misinformation.
Maybe.
Yeah.
We'll give you girls that for now, but we're after you. We're gonna
Yeah.
get you.
That was a bold statement.
Yeah, don't try to take the pretty from ladies. Stop.
Yeah.
Quiet down. Like, I don't know. I do think, I mean, definitely, there's some kind of wow about it.
Yeah.
I don't know. Is there another video?
I mean, it wowed me. I'm like all riled up.
Yeah.
Yeah.
We have a lot of numbers that we can actually gather data from, and we can think about these critically. Like, they're not perfect, but they're better than nothing. So we have regulating databases in multiple countries, right? So for us, we have the FAERS database, which is the FDA. We have Health Canada in Canada. We have TGA, we have SAFRA, we have the MHRA, a yellow card scheme in the UK. And we can go into those databases and we can look at their numbers. And of course, the FAERS one is the most comprehensive. It's the best one, I think. And so what we're seeing right now as of today is that there's 71,000 adverse events reported. And that spans, of course, from approvals till today. So all the way back from 1989 to 2024. Actually, it's December 31st of 2023 is the last update. So from 1989 to December 2023, 71,000 reactions, 12,000 of which are considered severe. And what that means was a medical intervention was needed. And then just right around 1,500 deaths. Now, the FDA has published multiple times that their database, although helpful, really only represents 1 to 10% of the amount or the total number of injuries for any given drug.
Right. That's the first thing that came to my mind. Yeah. So I'm glad you've said that. Yeah.
Yeah. So we're looking at really different numbers here when you do that simple math. We're actually looking at something like 700,000 adverse reactions all the way to like 7 million. That paints a much.
So let me tell you this about that.
Yeah.
Botox is used medically on people that are severely handicapped, right? Because it does, like when people have like cerebral palsy or they're like stuck with cervical
We were talking
dystonia.
that before. Like that actually
It's
helps
medically
a lot
used
of handicapped people.
A ton, right? Because any sort of like if you have like any sort of spasticity kind of disorder, right? It helps you. So how many of those people have comorbidities where they're like
1,532 years.
I mean,
it says 1,500 deaths in over 32 years. When you think about the billions of people that have been injected and all of the people that it helped, 1,500 people, like that could be a lot of people that were going to die anyway.
That's
or had
right.
Other
How many of
issues,
them
like,
are you talking about? Cosmetic patients or medical patients?
Yeah.
She doesn't differentiate that.
Yeah.
So I don't know. There's a lot of questions here where she's super sure that it was like getting rid of your 11s.
But what the
like,
average person thinks, is like, oh my gosh, I just went in to get rid of some
die.
wrinkles, and now
1,500 people died. It's like,
so that would be interesting to actually understand and break down the study to understanding like how many people over what percentage of time, because it's less than 1%. It's probably less than 0.5%. It's
less
like
than even that.
Less.
Less. I mean, you got to take the medical, and I've always said that a million times when people go, is Botox safe? And I was like, listen, if Botox is going to do anything to anybody, it's going to knock out the medical people first, because they use thousands of units on them. Like to do your face, it's never thousands of units.
Right.
Never, ever, ever,
And
ever.
all medical studies are exactly like that, and there's a percentage of mortality on everything.
Yeah, it is.
So,
I mean, it is a medication.
Yeah, I mean,
No doubt
and there's
about it.
always somebody that's going to have an adverse reaction. There is always, because it's different.
Right.
I mean, look at
and
all the things
sometimes
out there.
adverse reactions are bruises, droopy eyes.
Yeah.
I mean, the swelling, those are
Yes.
adverse reactions.
Right. The eyebrow that won't go down.
The wonky eyebrow.
I've had that.
The Spock eye.
I mean, I didn't get it at Dermafx.
Okay, well, that's why.
That's it.
So anyway, I just think that, I don't know, I guess just everything with caution, right? Everything, but choose for yourself. Don't let some girl be a hater and tell you what to do,
and also
tell
be
you what's
aware
true.
that everything, including the shampoo you use, has a percentage that
people that
have issues
That's
with
right.
it.
Oh, I'm allergic to that shampoo.
Anything
or
that's like unnatural, right? Even shampoo, soap, cleaning supplies, plus all the medical things that you have. Every procedure you've ever had at the doctor, they tell you. Even penicillin has a warning on it.
Yeah. Oh, of course. Well, botulism is a naturally occurring thing. Yeah. So I don't know how
interesting.
you want to call it natural or not, but there it is, right? So,
wow. A year.
Is so much safer than even an over-the-counter.
Than Tylenol. Because they're saying 1,500 people over the course of, what'd she say, almost 30 years. Yeah.
Yeah.
So it's like, what?
Yeah, it's pretty safe. It's super studied. They've studied
Advil's
it
worse than
and
Tylenol.
studied it nonstop. So I feel like it's a Swiss Army knife. They use it for everything now, like bladder spasms. I mean, they use it for everything.
Right.
So
they just want to get on you if you just want it to look pretty.
I know.
Yeah.
Why aren't they helping the medical people? I mean, go after it for like people with their heads stuck with cervical dystonia.
You shouldn't have that.
Yeah.
Yeah, could you imagine? Could you imagine everybody getting mad
How many
because
people have been
trying to
intubated
cure
with their
your
neck stuck
tremors?
like that? Yeah, you should live with those tremors. Just live with them.
Just live with it.
Just because you can't walk, you're all right. Just go with that. You know, it gives people their life back. So I don't know.
Totally.
You got to weigh it all out, but
that's interesting.
Yep. But bring the questions, everybody, and I'm going to look more at that study and break it down for us next time a little bit harder.
Yeah, totally. Thanks for having me. I love chatting all this stuff.
I know. I love it all too. I love all of it. So thank you guys so much, and bring your questions. We are here to answer them. And all right. Thank you so much. See you next time.
Bye.